Here in the Arizona Republican AZ Central newsroom, I'm Richard Rellis here with columnist Bob Robb. You're delving into healthcare and you get deep into why you think Arizona's healthcare options under the Affordable Care Act have stabilized. You also talk about some of the policy prescriptions that people have come to expect now and that Republicans are not countering with. You offer some things to counter that in your column. Do you think there is political capital on the Republicans to sort of get into the weeds of the Affordable Care Act?
I do not. And the main thrust of the column is that although Republicans talk about market-based alternatives centered in consumer choice, thus far they have shown neither the conviction nor the political courage to actually offer any alternatives that would include those features.
One of the things I get from reading the column is that healthcare seems really difficult. Like, is it something that the government has a faculty to be in?
There needs to be a government role in providing a safety net. Those that are seriously or chronically ill need to have their health care subsidized. But rather than messing with the health insurance market and trying to fund that through premiums that make health insurance a bad deal for the healthy, it should be done exclusively through the tax mechanism. For low-income people, we do that through Medicaid. I've in the past suggested that you could expand Medicaid to include anyone whose health care expenses exceed a certain percentage of income. But where you say we're going to charge healthy people the same as sick people for health insurance, you are always going to make health insurance a bad deal for healthy people, and they're going to opt out, as they were even when it was required under Obamacare. An awful lot of people were paying the penalty rather than buying health insurance that was not worth it to them.
Yeah, and I guess as we head into, well, not that our lawmakers are often knee-deep in policy anyway, but as we head to an election year where healthcare gets reduced to simple slogans and promises, how do you see any path forward in 2020 to resolving this?
Not for the things that I favor. The Democrats favor more government. We still do not have a individual health insurance market that works for everybody. It works for people who receive federal subsidies and are chronically or seriously sick. Obamacare has stabilized and takes care of that population. But healthy people who aren't covered by employer insurance are locked out of that market, or priced out of that market. So there still remains a problem. The Democrats have solutions. They propose either having government take over health care for everybody, or at a minimum for the federal government to offer its own insurance policy, which will only make a difference if it is also heavily subsidized. The Republicans, I think that is what the public will ultimately accept unless the Republicans step up to the plate and truly offer something that takes care of those whose health care need to be subsidized, but in a way that doesn't make health insurance prohibitively expensive for those who aren't sick or chronically ill. I see no evidence that they're willing to do it. They're afraid of their own shadows on this issue. And so I think that Democrats have the advantage in their march towards more government control of health care.